Hi, my name is Logan. I am a student physical therapist here at UAMS, and I am talking today about athletes facing anxiety. So, I'm going to start off by kind of just talking about what you need to know about anxiety. So, I'm going to start by just telling a few of the common types of anxiety disorders, and this includes panic disorder, obsessive compulsive disorder, generalized anxiety disorder, post-traumatic stress disorder, and social anxiety disorder. The one that I'm mainly going to be talking about is generalized anxiety disorder, and I'm going to kind of just start off by talking about what it is characterized by. So, it is characterized by at least 6 months of persistent and excessive worry, recurring about common events, and distress in performing day-to-day tasks. So, this can come along with some physical symptoms, including muscle tension, insomnia, and fatigue. And we'll kind of get into more of those symptoms later on in this presentation. So, some more of kind of what you need to know about anxiety is the prevalence. And I just wanted to point this out just to kind of give you an idea of, how many people around us are actually experiencing this and how common this could actually be. So it is the most common group of mental health disorders, and it affects up to 33.7% of the population in their lifetime. So 33.7% of people will have an anxiety disorder in their lifetime. And in the last year, 19.1% of the US adults have experienced an anxiety disorder. So as you can tell, a pretty prevalent topic and something that we need to be knowledgeable about. So there are some complications that come with anxiety and things that you're at an increased risk of if you do have an anxiety disorder, and those include comorbidities. So, and comorbidity for anxiety would be depression. This is one that is very commonly paired with. You're actually also at an increased risk of suicide attempt and substance misuse. So that could be alcohol or drug misuse, as well as just overall reduced life satisfaction and decreased work or school productivity. You also could experience some trouble sleeping, so this could lead to some insomnia, as well as some digestive and bowel problems. And then also just the overall feeling of just social isolation. So, how anxiety applies to the athletic population. So, it is very common for many athletes to be under many stressors, especially since they invest so much time into their sport and it's what they spend most of their time doing. So, there's a lot of consequences to their mental health that can come with that. This anxiety can come from the fear of failure and that just adding a big psychological stress to the individual. And through having all this anxiety, it can lead these athletes to have an increased risk of faulty coping mechanisms and increased risk of burnout in their sport, which is really sad because these sports started out as something that they really love to do and maybe even something that they have always done. And so for them to get to this point of burnout can be really discouraging for them. So burnout just meaning that they feel so much anxiety, they feel so much psychological stress from it that they end up quitting their sport. And I was looking at studies and found that there's actually a higher prevalence of depression, anxiety, and stress in female student athletes, with that statistic being 33.6 of elite athletes report symptoms of anxiety and depression. So, how can we apply this to physical therapy? So, the psychological response to injury can actually prolong the recovery from musculoskeletal injury. So having a anxiety disorder can actually affect how you recover from a musculoskeletal problem. So mental health disorders in athletes are associated with increased injury risk, prolonged recovery times, increased injury reoccurrence rates, decreased rates of returning to their own sport, and decreased rates of their performance after they return to their sport. So these are all just great things to keep in mind, especially as a therapist, and just making sure that you're keeping a lookout for these things and that you're just understanding how this affects their recovery time. And a lot of this comes from just kind of inherent barriers, such as there being a lack of identification, there being a stigma around mental health, and there being a lack of resource of resources availability to these athletes. But there are currently ongoing efforts to kind of create and implement different initiatives to take care of this, such as more mental health screening, better support systems, and better directed interventions to kind of help with getting these different associations down. More kind of physical therapy applications. So during the time of injury, clinicians are actually one of the athlete's key supporters. So that kind of gives us a role here. So how can we help? We can increase our usage of mental health and well-being assessments. So, anyone that walks into your clinic, giving them kind of an assessment just to kind of see where their mental health is and just to be able to see how you can better serve them and how you can offer them more resources. Um, we also can help by just being educated and aware ourselves of what anxiety is and what the signs and symptoms of it is so that can catch on to it quicker. Um, Another piece of advice is just not to be afraid to ask them questions. So if they say something that kind of makes your brain think that there could be an anxiety disorder there, ask questions and just be there for them. And then number one thing, share your knowledge and be encouraging and their cheerleader. Be someone that's always, positive and encouraging them to do better. So what to look for in your patients. So this is part of kind of being educated in how you can help your patients. So some signs is restlessness, fatigue, difficulty concentrating, irritability, muscle tension, sleep disturbances. So these are just some things that a patient could come to you complaining of that you could notice and be able to kind of figure out if they might be having some difficulty with an anxiety disorder. So, how life course, diversity, characteristics, and intersectionality may affect treatment. So, two things I kind of want to talk about was the populations affected. So, females are more at risk for anxiety disorders than males are. And how this kind of ties back to athletes is the female prevalence in sports. So, the females account for 43.5% of student athletes in the NCAA. And women are becoming more a part of the sports world as we know it, like it's becoming more and more of a thing. And so we need to be more aware of them in this setting and how their mental health is doing in this setting. As well as another point I want to talk about for the females is the female athlete triad, which includes kind of a constellation of three clinical entities, and that is menstrual dysfunction, low energy availability, and decreased bone mineral density. And this triad has actually been found to be significantly associated with anxiety and depression. So just another thing that kind of puts females, especially athletic females, at risk of an anxiety disorder. And then also the fact that anxiety is at its most common at 18 and 29. While it can be seen at any age, this is just an age range that it seems to be really common in. And this is the age group that has a lot of high school, college, and pro athletes. That's kind of the age group that we see that in. And so those two kind of correlating together can make sense of why some of these athletes we see have such a high risk of anxiety disorders. And then there are also just different risk factors from your life course, such as if you've experienced trauma in the past, drug and alcohol misuse, or having blood relatives with an anxiety disorder. So, how or what to communicate with patients experiencing anxiety? How? Approach the patient in an open manner. Try to approach them in a way that is non-judgmental and where they can feel comfortable with you, which kind of goes into my next point of creating a space that they're comfortable in. So, whether that be being in a separate room where not the rest of the gym can be with them and they're able to do their exercises freely, that can be helpful for them. If it's a certain they would rather have a girl physical therapist versus male physical therapist or the other way around. Just letting them have a lot of choice and kind of giving them options and then letting them lead the conversation, trying to be an open place for them to talk and for you to listen and letting them share what they want to share. And then encourage them. What we can say in these conversations is encourage them to stay as active as they can, and you can help lead that by knowing what they can do activity wise. Teach and encourage them how to use deep breathing techniques during times of anxiety. So, if they're having anxiety while they're in your clinic, you can help them with some breathing techniques. And then educate them on the resources around them and encourage them to use those resources. So, you're not a therapist, but you do know therapists around you, psychological therapists that can actually help them with these problems. So make sure that they know their resources. And then here are just kind of some different services and resources for referral. The top ones being if someone needs immediate help, and the bottom ones just being places around here that could actually um, support you and give you some help. Some of those at the bottom I tried to make sure were a mix of ones that are close in Fayetteville and then some that are further out in Northwest Arkansas. Thank you so much for listening to my presentation. I hope you have a wonderful rest of your day. And then here are my references.